Turquoise is in the price transparency business. So before January 1st of this year, it was impossible to know the price of healthcare, especially hospital care, until a federal law permitted the prices of healthcare to be posted online. And so Turquoise is building towards a future where we have savvy consumers of healthcare and they know a full value proposition in advance of choosing where to get healthcare services. And so we started with building out some data pipelines and sharing that data to the world this year. We're building some solutions that help providers and payers negotiate the new cost of care.
So this whole concept of price transparency is one that's been making the headlines for the last couple of years. It's obviously been a mainstream topic that largely driven by regulatory change and policies that have been going into place. Is this an idea that you had many, many years ago that you thought was inevitable, or how much were you influenced by all of the changes that were happening in the macro environment within healthcare?
Yeah, it's really odd because working in hospital revenue cycle, really, it's the most boring thing to talk about at parties. Like people would ask me in my 20s, like, what do you do? I'd try to say, I find hospital underpayments, I mine hospital claims, and people's eyes glaze over. But in the know, you see these contracts and you see what Blue Cross is paying XYZ health system. You see how much money this is. And as a 23-year-old analyst, you're like, this is huge. This is a lot of money flowing through these scanned PDF contracts that are secret, that I only have access to because I work for this consulting firm. And fast forward, Adam and I were doing some machine learning for hospital revenue cycle under a different company. And this law hit that required hospitals to publish their standard charges, which in 2019, the term was charge master. So the hospital just published their list price. And that is the price that hospitals charge, but really nobody pays unless you're a foreign dignitary or a very rich uninsured person and they smell blood in the water. And Adam and I went through this side project of aggregating all these hospital charge masters. We made this thing called a national charge master database in 2019. I don't really remember why. We know that nobody really pays list prices, but it was just fun. And we didn't do much with it. And then in late 2019, they updated the rule to say, hey, our definition of standard charges was too limiting and we want hospitals to publish more. And so then they defined under the Trump administration that standard charges means the negotiated rate for all items and services at a hospital. And that's when Adam and I just said, whoa, this is huge. Because if this is true, all of these PDFs that we're looking at will in effect become public. And we know how much of the cost of care flows through these negotiated rates. So that's when the price transparency path just felt illuminated in front of us.